Hi there, I'd like to introduce you to the Bell Clamp by Lunderg, our newest, most comfortable solution for managing male urinary incontinence. When you open the box, you'll find a carrying pouch, the Bell Clamp, and 3 interchangeable top silicone pads in sizes small, medium, and large. What makes the Bell Clamp special? It has an ergonomic bell-shaped form that centers the male member and helps prevent side-to-side movement. The shape, combined with cutouts in the top pad, allows your main blood vessels to keep flowing freely, so you can wear it comfortably for longer periods. The lower arm has a fixed, ultra-soft, medical-grade silicone pad. The upper arm is where you attach your choice of small, medium, or large, medical-grade silicone top pad, depending on what is most comfortable for you. Remember, a small amount of pressure is enough to stop leakage. You don't need to over-tighten. Let's talk about how to use the Bell Clamp. First, choose your top pad size, small, medium, or large. Each pad is clearly marked here, and when you attach it to the upper arm, make sure the pad size marking is closest to the ladder lock. This ensures the pad is securely in place. You can see here that there are longer and shorter holes on the pad, which match the longer and shorter stabilizers on the upper arm. Attach the silicone pad to the upper arm, making sure the longer hole on the silicone pad is attached to the longer pad stabilizer, and the shorter hole on the silicone pad is attached to the shorter pad stabilizer. Again, if the pad size is closest to the ladder lock, you've done this correctly. When you put the clamp on, you will want to place the clamp about 1/4 to half of the way down the shaft from your abdomen, with the ladder lock to the right of the male member, while the male member is in a relaxed, flaccid state. Before closing the clamp, align your veins to the cutouts on the upper arm pad. The dorsal blood vessel at 12 o'clock should sit in the first cutout. The vessel at 4 o'clock should be in the second cutout. If possible, the vessel at 9 o'clock can sit in the third cutout, but this is the least critical. Once aligned, close the lower arm gently on the male member and lock it into place using the ladder lock, which again is to the right. Adjust to the minimum pressure needed to control leakage. Every 1.5 to 2 hours, release the clamp to urinate and slightly reposition it on the shaft a bit higher or lower than before to maintain blood flow and avoid irritation. Check the following to make sure you've done it correctly. Standing with the male member facing towards you, ensure that the size of the pad is next to the ladder lock is to the right of the male member, veins are positioned in the cutouts on the upper arm, and the clamp is comfortable and not too tight. Now let's go over some additional tips and information about the Bell Clamp. The Bell Clamp has no metal, so it's safe during MRI scans or metal detectors. Cleaning is easy, just wash with soap and warm water, then air dry. You will want to avoid clamping on wet skin and lightly trim hair if needed for extra comfort. Please replace your Bell Clamp every 4 to 6 months for optimal performance. Please read the manual for further instructions, and if you have any questions or issues, please contact us and we will reply within 24 hours.